My name is Raissa Mapinduzi. I'm a senior nursing student at Maria College. My presentation for 2021 academic symposium is Catheter-Associated Urinary Tract Infections. The most important risk factor for developing a catheter-associated urinary tract infection is prolonged use of the urinary catheter. I used 5 peer-reviewed articles. The settings were ICUs and emergency departments, and all the research studies aimed at reducing the catheter-associated urinary tract infection in hospital setting. The Anna Maria College BSN program student learning outcome was patient-centered care and safety. Why is significant to nursing practice? Catheter-associated urinary tract infections is the fourth leading cause of healthcare-associated infections in hospitals in the United States. The impact of catheter-associated urinary tract infections to the patient and the healthcare system include patient discomfort, increased mortality, longer length of hospital stay, higher healthcare costs. What is being done to address the clinical practice problem using the nursing focus? Decreasing the patient harm of catheter-associated urinary tract infection incidents by focusing on cultural transformation. Engaging clinical nurses in designing and implementing practice changes. The Catheter-Associated Urinary Tract Infection Arrest team from the neurological ICU designed a three-pronged approach. Best current evidence supporting the approaches to addressing this practice issue. First, decreasing the patient harm of catheter-associated urinary tract infection incidents by focusing on culture transformation. A core group of nursing staff, leadership, physicians, and infection preventionist team used several incremental cycles of the Plan, Do, Study, Act process for assessment, review, and adoption of each change, which provided the opportunity for the changes to build upon each other. The second was engaging clinical nurses in designing and implementing practice changes. Nurse leaders empowered clinical nurses to identify and address catheter-associated urinary tract infection improvement opportunities. They fostered a culture of teamwork that facilitated interdisciplinary communication around urinary catheter appropriateness and alternatives. And finally, they held clinical nurses accountable for catheter-associated urinary tract infection process and outcome measures. Third was the Catheter-Associated Urinary Tract Infection Arrest team from neurological ICU that designed three-pronged approach. The first was evidence-based interventions, second was in educational interventions, and the third was supportive interventions. Implications for nursing practice and future nursing research. Implications are minimizing inappropriate catheter use by applying appropriate catheter indications, aseptic insertion of catheters such as hand hygiene, catheter insertion using aseptic technique. For future nursing research, undertaking investigations should provide more clarity on indications for the use of indwelling urinary catheters specific to neurological ICU patients who have unique needs. These are my references. I use 5 peer-reviewed articles from Anna Maria College library database. Thank you for listening.